The movement phases of the squat start off with the descent phase, where there is flexion in all three joints of the leg. The descent phase starts off when the individual moves from the standing position and begins flexing all three joints of the legs. The ankle during this descent phase shows significant support and aids in power generation. A high degree of ankle mobility is needed to help with the balance and control of both phases of the squat. The gastrocnemius, as you can see right here, is the primary mover of the ankle complex. However, it is said that the soleus is more active than the gastrocnemius when squatting in high degrees of flexion, which we will talk about that in a second. The articulation of the tibia and the femur is classified as a hinge joint, and it is possible to get from 0 to 160 degrees of flexion from this joint. But here we can see that I'm only at about a 90-degree angle from the ground. There are a plethora of ligaments that help to keep the knee joint together, perhaps the most important being the ACL because it stabilizes the tibia from translating too far anteriorly. So without it, the tibia would be moving forward this way. The hamstrings are considered the agonist of the quads. The hamstrings are considered the antagonist of the quads, but they help with the pulling of the tibia from the back, which alleviates some stress from the ACL. The hip is classified as a ball and socket joint coming from the acetabulum to the head of the femur. Hip flexion during the descent phase is moved with an anterior tilt. So you can see how it kind of tilts forward. The primary movers of the hip joint are the glutes and the hamstrings. The glutes play a big role in both phases of the squat, proving that it helps with the control on the descent. It is common that an individual will stop the descent when the thigh is at least parallel to the ground. It is common that an individual will stop the descent phase when the thigh is at least parallel to the ground. And here we can see for this example that I decided to stop when I was parallel to the ground. It is not uncommon to have the individual performing the squat go past the parallel point and get full flexion of the hip and knee joints. Squats can be put into 3 basic groupings: partial squats, half squats, and deep squats. Partial squats being only 40 degree of a knee angle, and half squats being 70 to 100 degrees. I think this would classify as being a half squat, whereas I am about 90 degrees. The deep squats are greater than 100 degrees, which would be ass to the grass type of squat. This next point in the lift after the descent phase is the ascension phase of the lift. It is initiated and achieved through extension of the ankle, knee, and hip joints. Activation of the gastrocnemius for the ankle joint decreases as the phase and the knees extend. You can see my calf start to alleviate itself from flexion, no flexion in the calf. Most of the muscular force from the knee comes from the quads during the ascent phase of the lift. Peak quad activity usually comes from about 80 to 90 degrees. About here, we're having peak quad activation. During the ascent phase, the glutes are thought to help with knee flexion as well due to its attachment to the IT band. At the same time, while the leg joints are in motion, the posterior and anterior torso and core muscles act in an isometric contraction, creating tension in the abdominal wall to be able to support the upright posture of the spine while the individual is bearing weight on their back. So you can see how I have a neutral spine the whole way through. Proper squatting technique requires a rigid spine that eliminates all plantar motion. So there's no forward lean in the spine.